even if you're a fresher, if you study for these 4 months, the next preparation you will definitely have a benefit. Or what if it is possible that with your 4-month preparation you can get a good rank? Most lectures, they are like, yeah, the professor teaches you, he's giving you information most of the time. But now what he planned was, okay, you are the single person, now we'll interact. So he gave me a case scenario. So he's like, okay, now you have a 55-year-old female. Yesterday only I saw her after the first postponement, and I gave a GT after that. I saw my scores to be dipping a lot. Then when I saw that my scores have dipped, I got a wake-up call. So my advice to all the NEET PG aspirants are there, that your assessment should go on. In many instances, it would happen that I used to open my phone for something very important. Like I wanted to see a timetable, what I'm posted in, but I went to Instagram and then I went to Facebook, and then I used to forget that what I opened my phone for.
My name is Chinmanan, and you have started watching podcast with Earthly, and we are in the second episode of the podcast with Earthly, and our guest today is Dr. Sameer Shaikh. Recently, NEET PG 2021 happened and results came out, and he got the score of 646 out of 800. So I thought, let's call him, and I thank him that he accepted our invitation, and he got a good rank, that is 452.
Hello everyone who's watching me. I'm Dr. Sameer Shaikh. I did my MBBS from Lokmanya Tilak Municipal Medical College, which is popularly known as Sion Hospital in Mumbai.
So let's start the formal questionnaire. So I have prepared some questions for you. My first question to you is, what was your first reaction after seeing your NEET PG entrance report card? Tell us something about that moment.
So I was at my home, and then so first the scores announced, and when I saw the score, so I checked it few times more. I was very happy at the time. I called my best friend. I said him that I got 646, and the thing he spoke was, he said that he too got 646 marks.
Wow.
So we both were very happy.
On to question number 2. What was your biggest fear during PG preparation?
When I started my preparation, my biggest fear was about the paper pattern. So what I saw during my analysis was that every year the paper pattern was different, and due to that, and every institute used to say that it will be more clinical, So due to that, I have taken many efforts to solve different clinical vignettes and all. So I wanted the paper to be clinical, so that it would not, the competition will not be as tough as it was in the main exam. So when the biggest fear was there, but I made myself mentally so stable and strong that I said that whatever the paper comes, we are going to give our best, and we'll make way through it anyhow. So that was my biggest fear about the paper pattern.
So moving on to our next question, sir. What was your source of motivation during preparation, and who was your idol?
So my constant source of preparation was my dream branch. So medicine being my dream branch, so we needed a top rank to get a good institute for medicine. So my motivation was, I used to write on my books as well that I wanted medicine, and so that was my constant motivation. And I have seen my seniors who were medicine postgraduates, so I always met them, and they were my constant motivation. They used to say me that, Sameer, you are going to come in medicine, just keep what you are doing. And my ideal was our HOD sir, Dr. Nitin Karnik sir. So he's not only a great clinician but also a good teacher. So I always wanted to be some amount, like 1% of him.
Moving on to next question, sir. Which branch are you interested in and why? Like, what is the major reason behind it?
So for my post-graduation, I'm interested in medicine. So from my second year, I was exposed to all the branches. Like firstly, I was exposed to surgery and all the branches. But when I saw that like I like to communicate with patients. I like to interact with patients, and I loved the point when they used to thank a doctor, especially after they have been treated. So I wanted patient interaction, and I used to off hours, like after the posting, I used to go to wards and I used to see patients. I used to examine them, and then it was fascinating for me to see new cases. So I always wanted to be a physician.
So moving on to next question. Which subjects were tough and which were easy to go while preparing?
So at start, I felt few subjects to be very difficult. Like I felt biochemistry to be very difficult, microbiology to be very difficult, even ophthalm to be very difficult. But then later I realized that these subjects only needed revision.
Yeah.
And then after later I realized that medicine being a vast subject, it was very difficult for me to revise it. Yeah. And there was a very big blanket to cover. And they were very difficult to guess what topics could be asked. So initially, ophthalm, biochemistry, and microbiology, just because they had few amount of actual topics, I used to face problems in them, and I hated them. But when I did my 2 readings in them, then it was a piece of cake for me. It was very, very easy because I've made charts of them. I've constantly revised it. Then later I realized that medicine is very unpredictable, and then that was the difficult subject.
How often you were revising surgery, while preparing?
So I didn't target specially surgery. So for revision, I used to feel one point that when I used to complete 4 subjects, 4 or 5 subjects. So the first subject which I started, four subjects before, I used to take that subject and I used to solve a subject-wise test of that subject.
Yeah.
So that was my mode of revision. So I used to, so now after solving an SWT, the topics which I feel that I'm wrong at, I used to go there and read the topics, because I felt that when you are revising, you need a better approach and better strategy. You just can't go and read it. And for the factual part, I already had my Pearls bookmark or any charts which are made, which I used to see every day.
Next question, sir. Please share your routine during exam preparation, hours of studying. Do medical students get an extra time for co-curriculum like going to gym, doing meditations and other stuff?
So I prepared during my internship. So during the COVID pandemic, it was actually very difficult for us at the start. We already planned, we used to ask our seniors which postings were very heavy, which postings were light. We planned according to it, but then COVID pandemic came, and then we were put on compulsory duties, and it was very variable. Yes. So in general, apart from that, I feel that when you have a good timetable, you can get time, and especially I feel that you should give at least 1 hour for gym yourself or meditation, so that, because I feel that when you are very planned to sit for 10 hours or 8 hours and you are going to read it, I feel that 1 hour is your best time, and it makes you fresh for the whole day. So you should take that time and you should keep it for some exercise, so that you are refreshed for the whole day apart from your posting. So I suggest that you should go through it, because when you read subjects and when you study for continuous 1 week or 2 weeks, you will definitely feel a day of fatigue or burnout, and then you'll have to take that 1 day off to be refreshed. So it is better that you keep a timetable. I used to go to the gym at the start, like during the 8 months, and start during the point also, or I used to do at my room. So it was possible, but only the point is that when the exam is at 1 to 2 months, it gets difficult.
Yeah, it's difficult. Yes. Yeah.
And when you see that the other students are they're sitting for 12 hours, 15 hours, then it gets more difficult for you.
दोस्त को देख के और motivation आता है.
Yeah, it's more psychological. So it's like I can't waste that 1 hour. Like I used to do in the morning, so it was good, but you can't think of doing it in the afternoon. You waste 2 hours for it.
Next question, sir. Tell about NEET PG 2021 paper pattern. What was the approach while solving the question paper? Means I'm saying during your grand test and also during the day of exam. Were you marking some question for end or solving them at first go only? Like there were some bookmarks, like we can put bookmarks. Were you putting some bookmarks while grand test?
So during my final paper, So also few papers before my exam, the final day, I solved in the same style. So my seniors and even most of the teacher used to say that your 30 minutes of the first 30 minutes of the exam are the crucial period, because even when you sit there, it's a new environment, then you get anxious. That's very normal to get anxious during the first 30 minutes, and you'll also have the inertia. So what I did during the last few papers of my last GTs of before my exam was, like, I used to have my exam at 9:30 to 12:30 on the exam time. So what I used to do it at 7 o'clock when I used to wake up after freshing up. At 7:30 I used to solve custom module of Marrow of 25 easy questions, only easy questions.
Yeah.
So that was a sort of warm up for me, and that cleared my inertia in some amount. And when I solved the starting for the 30 minutes or the 30 question, I used to go in and approach that I want to solve straightforward questions. I don't want to mess up questions which are taking more time or which are very difficult very clearly, because that are going to take more time, and then I will be thinking like, okay, I've wasted more than two minutes on this question,
Yeah.
and I still don't have an answer.
Yes.
Or you'll definitely, like, it is basic statistic that in a 10 question set you'll have one or two questions which are going to be difficult.
Yes, sir.
And it could be that it is your first question, which was same scenario
Yeah.
with me. I had that alprazolam question on the first, like the first question of mine was alprazolam. I took 15 seconds to read the question, 15 seconds to read the option. Then after 2 seconds, I was very clear that I don't know the answer of this question.
Yeah.
So what I did was I reviewed it, I kept it for review, and then I moved forward. So during that 30 minutes, what I did was I picked, or I gave all the answers of all the straightforward questions.
Yes.
And I left all those questions which I felt that it was very difficult to waste time here, or which were clearly difficult. So that was my approach.
So next question, sir. How often you were solving grand test, and how many grand tests you have solved till date?
So as said by my seniors, so when I started my preparation in Feb 2020, so I gave my first GT in the first month itself. So that GT I used as a baseline GT. First 6 months I gave monthly GTs, and then after the 3 months I gave in 15 days. So in 15 days, and that period after my first reading, I started assessment.
Yes.
So only after my first reading I started assessment, how things were there, like which topics I am wrong at. But the first 6 months I gave only to see how good I am at time management, how, like, and also to give myself confidence that the topics which I have not studied, I have still idea about it, and I used to guess the questions based on what knowledge I have.
Yes.
And like we had 18 months of preparation, so it was very ups and downs for us.
Yes.
So the main point was that during the last 1.5 month of my preparation, I gave GTs at 7 days duration. So every 7 days I gave it, and I used to keep the style same, or I used to improvise it, and I used to write all the points which I'm making the mistake before the exam, like the main things.
Yes.
Like, so I've improved, and then I followed into the subsequent GTs.
Yeah.
I had a GT book.
Yes.
And in that GT book, then I used to analyze my topics as well, and I used to write all the difficult topics. Like I spoke to Deepti ma'am, which is the Obs Gynec professor in DAMS, and ma'am said me something about 3-column strategy. So 3-column strategy was, after every test I used to take a piece of paper, make 3 columns, and I used to write topics in the first column which I got right, or which topics which are there which are nice for me, or which was okay for me. In the second column I used to write topics which were based on recall, which were factual, and which I made mistakes.
Yes.
And in the third column I used to write topics which I've never heard of, or they were very difficult for me. And when I had those 3-column strategy, then I used to see all the topics and I used to work on them. So that was my strategy.
So my next question to you is approach to preclinical, paraclinical, and clinical subject. Like in a short paragraph, if you want to explain, how will explain it?
So what I felt was, I felt that when you see the clinical top subjects, you have almost around 20 to 35% of data which is already there in your paraclinical subjects.
Yeah.
Or your non-clinical subjects like anat, physio, biochem, and your pathopharmac FMT. I always stressed a lot about in these subjects, at least on the start of my preparation, because when I did them strong, I can give you example, like all your heart failure drugs, all your drugs with mechanism, they are explained both in pharmac as well as this. All your glaucoma drugs, they are explained in your ophthalm as well. So when I went to those topics, especially pharmac helped me a lot, even patho. So I saw that all the medicine and surgery, all the pathophysiology and all the drugs are already what I've read. So that was the point, that I only had to read clinical features and few investigations. So I felt that it is very great to read them simultaneously. So you will definite point that you should not never ignore all your preclinical and paraclinical. It is better to read alongside as well.
How difficult was anatomy for you? Because anatomy very difficult to remember.
Yeah,
Nerves,
so anatomy
plexus.
is similar to medicine. What I said, that these are few subjects which are very vast. So it was very difficult for me to. I used to solve MCQs and cover my topics. It was very difficult, and it had all the diagrams. Like at first, the normal diagrams, like all the muscle and all, it was very easy to see. But when the cadaveric images step in, then it was very difficult, because we didn't have a good source to read all those. And when I saw them, it was very difficult. And every time they used to go one step. They used to take a muscle, then they used to say a triangle, and then they used to make a clinical question.
Yes.
So what I feel is, what my advice is to stick to the topics which are there in the previous year questions.
Yeah.
And stick to your notes. It is going to be a new topic, which is new question which is going to jump in, and it is going to be as unique to you as well as to other participants.
Yes.
So I don't think it is good to take a special effort and go to anatomy in a vast, because it is itself a river. It is going to be very vast.
There are some short subjects. We call them as short subjects, but I feel those are very vast to study and very difficult to study. Like FMT subject is totally fact-based. Then we have anesthesia, and then we have one more short subject, psychiatry. So what was your approach on these subjects?
So these subjects, during my first 2 months, when I read it, it was like it was very theoretical material for me. So when I finished it, I was okay. Like when I finished it, I solved MCQs. It was good because it was in my recent memory. So when I went forward I felt that everything is washed off. And then I used to ask my friend about IPC and all. So then I used to feel that it is way better to read these subjects in a discussion manner.
So my next question to you is online platforms versus reading standard textbook, and I want to add on to it, in how many months you completed your complete 19 subjects?
Both of these have a different role to play in. So what I wanted to emphasize on online platform is, every online platform, so they are helping you to prepare about your NEET PG. They worked hard to get the topics which were previously asked, and they are predicting your topics, and then they have made your perfect notes so that you revise them into a short time. So they have the online platforms have directed you to study. And on the contrary, your standard textbooks which are there, so what I feel, till third minor or your third year, till your PSM, ENT and ophthalm, you have good standard books to read and you get ample time to read them. But when you go to final year, apart from Love and Bailey, when few people think that Harrison should be read in UG, that is where the point is. So I feel that there is that point which is there, standard textbook take a lot of time, and your online platforms give you a directed study, especially for your NEET PG. You can go to you can read your Robbins, your KDT or your you can read them till your third year, and then you'll have to be more selective towards your final year, because you'll have 9 subjects in your final year, and then it will get very difficult for you to complete them. So, and the main point is, then you have a target of NEET PG, so that is there. And when I've completed my 19 subjects, so I started my proper planning in third minor. So I started it, and until the end of my final year, so I've completed my subjects of second year, third year and final year. So first year subjects which were remaining. So when I started my internship, so before internship and in the first half month of internship, I got around 30-40 days and I completed my first year subjects. The first, like I've seen the lectures and I've read that notes for the first time until the first month of the internship. So that was the point, and after that I started my first reading as a 19 subject.
The question is last month strategy versus last week strategy. versus day before exam and the day of exam, or what mindset we should carry as an aspirant. And one more in that, the anxiety, that feeling, butterflies in the stomach. How to cope up with that?
So starting from the last month to the last day of exam, the most important point I feel is that you should be grateful and you should be very positive about your preparation. Like you should go back, you should make a flashback, and you should tell that, like if you have started even from second year, especially the last year which is there, that you have done great during that 11 months of your preparation, and you have completed whatever you have completed. Whatever you have completed, you should be very grateful that you've been able to complete that, and you should be positive that no matter what you should not focus on all other things, and you should focus that point that you have given your best, and you should go through. So and the into the academic now, in the last month, your aim is to do a last revision, and somehow you'll have to read your notes some point to point, or whatever you have to read those important points, but you should go mentally through all those subjects. That is your main aim, because you want to feel that in the last month I've read all the subjects. So it is, everyone has different strategy to revise during that last month. In the last week, you should have topics which are very factual, especially PSM, Obs Gynec, then your Pharmac, then your microbiology, then your biochemistry. So these subjects which should be there lined day by day, and you should have those confidence that now, yeah, we know that microbiology is volatile, we know that biochemistry is volatile, but now we are reading it 2 to 3 days before the exam, and now we have very greater chances of retaining them. And that should be your in the last week. And the last day, what I feel is you should read only your GT analysis book, like the book which is there, which you had all those GTs, like you might have given 20-30 GTs. So the questions which are there, they will have all those hot topic questions. You'll have rare topic which you have kept or you have read few times before, and that should be there. And you can see, like even in your last week, you should at least do all the 3-year previous year questions.
Yes.
So in the last week, what you want is positiveness, and what you want is a bit of, yeah, like I can do it. And to best thing and the best time to check that is your last week, and you should do it by your previous year. And definitely what I feel is that I was very, very anxious seeing that what my preparation is at present. But when I saw those previous year, I saw that I got to solve most of the questions nicely.
Yeah.
So that was a boost up or power up for me, that I can do, like yeah, the competition might be there, but I can at least do to the level which was asked last year. So that gives you a boost up in the last week. And the last day, I was a calm person. Like there are different people who read the last night as well, but yeah, I was a calm person. I wanted to finish everything by 7 p.m. and then I spoke to my family, I spoke to my friends. We were very calm, and then we were like, okay, whatever paper comes, we are going to give our best. We have, and you should make yourself, and you should tell yourself that you have solved so many exams. You have solved so many GTs, you have solved so many SWTs, and you have finished your reading. You should give yourself positiveness in the last day, especially on the last day, and you should tell that whatever pattern comes, whatever paper level comes, you are going to give your best.
The night or before the exam, did you get sleep? You had a proper sleep, or you were like thinking about the next day only?
No, so what my seniors said, they said me that before, like around 7 to 10 days before your exam, you make your routine like that. You sleep at 10 or 11 and you get up at 6. So that was my final day program as well, and I planned to do it since the 10 days before the exam. So I was very calm during the exam day. I saw my friends, most of them were very anxious. Yeah. Like some they said that later when I asked them, they said that I didn't have very good sleep and all. So I feel that you should plan yourself. You should make that routine at least 7 days before your exam, because I feel that sleep matters a lot, because the exam day factor is also a point that you should focus on. So how your mind is there, how fresh it is, and how good sleep and food you have taken on the day and before the day of exam is very important.
This NEET PG 2021 got postponed many times, right?
Yes.
So how you took it in the positive way? Would you explain?
Okay, so we had our exam in January. It got postponed to April, and then it got postponed to September. So when the exam got postponed, we had a point that like I studied a lot, and I got fatigued at the time. So I felt that I should take a break. Then I took a day off, and I saw that most of my friends are taking a lot more.
More.
But I felt that when after that, like I took 7 days break after the first postponement, and I gave a GT after that. I saw my scores to be dipping a lot.
Yeah.
Then when I saw that my scores have dipped, I got a wake up call. So my advice to all the NEET PG aspirants are there that your assessment should go on. Like you have planned your GT should go on. Okay, now what you might have planned till then you should set a new round of GTs and your SWTs, because that are going to tell you that now, yeah, you are going out of line and you are going out of performance. And the main point what I felt is in the most important point for a NEET PG aspirant was consistency. So you have to be connected to that subject. Like most of my, like I used to not do things which are very out of studies just to be connected to the preparation. And that is the main thing. If you are going if you are taking a break of 7 to 15 days, you lose all the factual points. You might have kept them on those remote memory, but you have psychological point that okay, I might have lost all those factual points, and then you take that vicious cycle and you feel that okay, now then I have to read again and again. So and it falls you into misery. So better that what I did during that point is what I felt that during these points your best friends are your best friend is your study partner who is well motivated as you, and you should keep in connection with students who are motivated rather than students who feel that okay, the exam is postponed, we should relax.
Your support system at home, mom or dad, or with whom you want to share your success?
From the start, I was more close to my dad. I used to say him all the small things which I used to experience in my college life and everything. From the start, I was more close to my dad. My mom was very helpful during my preparation as well. Like during the COVID pandemic, we used to video call to our parents and we used to talk them. And it was very motivating already to see them on video call. So and then my dad, I used to everything, some or the good or bad things used to happen, and then I used to talk every single thing, and he used to motivate me. Like I had very incidences that I was scolded by a professor, or I used to feel like I was in one of my ICCU posting, I used to feel that I was worked too hard, and they used to work us very a lot, and we used to keep us for 2 hours for all the other work as well. So I used to get fed up, and I used to call him, and he used to calm me down, and he used to say me that okay. And the fortunate point was that, and the other shocking point was, he's not in medical field, but he used to understand all the things, and he used to say me that he used to tell me about his experiences during his first period, and he used to say me once during my community posting, I was scolded by or threatened by a cooperator, and I was very I lost it, and I felt that now I am going to be they are going to pick me up, and then they are going to scold me in newspaper or something. I called my dad and I said that okay, so he just told me that it is very normal for them to call and threaten only because the work is not done, and it is the fault of system and not only you. So, and there are many instances when I felt like okay, I'm just not reading, but he said me that go slow and steady. Whenever you feel that you are very tired, go for a movie, or at least do something or eat something which you like. So I was very flexible with my dad, so it was very good time to share with him, and I improved a lot, and I sustained all that ups and downs.
Was the posting at Sion Hospital was very hectic, or it was like cakewalk?
Okay, so when we planned that we are going to bunk few postings and we are going to attend, because we knew that some postings are there, not totally bunk. There was used to system that we used to attend an emerge of 24 hours, and then we used to do it was considered to be 4 to 5 days work. If you do a 24-hour emerge and you help them, it was like you'll get an attendance of 4 to 5 days. So you know that after you do a 24-hour shift, you have 4 to 5 days to spare.
Yes, sir.
But what happened during the COVID pandemic was that we got different postings, and it was a very new scenario for everyone, even the healthcare workers and the non-healthcare workers which were there. So it was very, very difficult for us because we used to have a new timetable of posting every 15 days. So every 15 days, before 15 days, on the 14th day, we used to have a small heart attack.
Yeah.
Like we used to pray that we should get a new posting, and it should be a good posting.
Yes.
Because we wanted to study. And then unfortunately, some people got very bad postings. I got few bad postings multiple times, and few people I saw that they got very easy postings multiple times. I used to be frustrated. I used to request my professors and all, but nothing worked. And then when I saw it, at the first I saw that it is very difficult, and then at the second time I realized that it is doable. Like I realized that when you plan something and it doesn't go according to your way, then you at first you are very like in an agitated way or in a denial way, but then you have to make something work out. So you'll have to make your mind mentally stable and mentally prepared that you might get. So after a few postings, we are mentally prepared that okay, we are going to get a difficult posting, and we'll go through it.
Yes. So my next question is, are you satisfied now, or still you feel something is missing?
No, I feel that my satisfaction have come from the point that I've given my best. Like I already planned it from few years. I said that now I'm going to give all those things, and like I said, I was very fortunate that I didn't have a lot of severe ups and downs. And I'm very satisfied because I am with this rank. I am happy about my dream branch, dream city, like I might get my dream college as well. And so I'm very satisfied with it.
Then I asked this question to Dr. Milind Shinde also, that social media, how to avoid it? And it's like as a distraction, how to avoid it?
So what I felt was, what I did during my preparation was, I was introduced to the Forest app by my friend. So it had then we used to log the apps. Like it used to keep on your study mode, and then I used to keep that. So and the point what I felt was that many instances it would happen that I used to open my phone for something very important. Like I wanted to see a timetable what I'm posted in, but I went to Instagram, and then I went to Facebook, and then I used to forget that what I opened my phone for. And then I used to keep my phone, and then I used to feel frustrated, and then I used to open it, and I would realize that I wasted 15 minutes to something else which and during my preparation as well, when I used to keep my phone, it always used to buzz up or some notification would come up, and then I realized that I need an app or I need something, or I should keep my phone. It was very difficult to keep the phone on airplane mode.
Next question. If anyone want to pursue rank, what should be his mental strategy? How to be motivated during this preparation? Okay,
so first of all, what I feel is that to get a good rank, you need a planning. So planning should be a long-term planning and a short-term planning, and you should always make it very practical. You should never do it like if you have not studied pathology very nicely during your UG days and during your second year. So when you plan it during your internship, you should never keep it for 2 to 3 days or 4 days.
Yes.
You should make your make your practical analysis, and you should give those days. So during your 6 months, always keep a planning which is very practical. So I see many students, they keep a very like out of the line planning, and then they feel that I didn't finish these subjects, and they get demoralized about that.
Yes.
So the main point during the preparation to get a rank is planning. And apart from that, what I feel is you should have a company who appreciates your effort. You should have friends who appreciate your rank, and you should have your own progress chart, your graph. You should plot yourself on your any paper or something, and you should feel that now you are going. Because what I feel is that the main thing which lacks is your reward in your short-term things.
Yes.
So you don't see a reward, and then you feel that what am I doing this for? Like I see most of my friends, and then I are in one paper when they don't score good, they feel like, yeah, I'm already down, and it's nothing to worth it to do for. And then you should also feel that you should also have one thing in your, like I had my dream branch, and I wanted to do it, and in the bottom of my heart, my ideal was there and my dream branch was there, and I used to meet my seniors very frequently into college, and they used to motivate me. They used to say me, yeah, Sameer, you are going to come to SAN for medicine.
Yeah.
So that was a feeling like I used to feel like they are not expecting, but they are feeling that I am capable of doing that.
Yes.
When you have the environment that they say that you are capable of it, and they motivate it, then you itself, the self-doubt which is there, it goes off, and you keep it consistently.
Yes.
Even if you have a down period, if you meet a positive person or a positive senior who is going to motivate you all the time, that self-doubt goes in, that bad period goes in, and you are already on track.
Next question is message for students who gonna give upcoming PG entrance.
Okay, so what I feel now, the main difficulty they might have been facing is that the date have come up, and there might be some amount of panic or anxiety in them. So some students might feel that they are not well prepared.
Yes.
And to be honest, I was not well prepared after studying that, and I have seen few of my seniors who have studied 2 years, and they were not well prepared.
Yes.
So a perfect preparation or a well preparation does not exist, and it is very unpredictable. So what you have to do is you have to be consistent to whatever time which you have it. Like there might be students who are interns and who might say that we have only 4 months and we have difficult postings. So I want to say them that if you have difficult posting, whatever time which is there in that posting, give that to the posting, and apart from that, do justice to that time.
Yes. Yeah.
You can't just make excuses or blame that you have a heavy posting and waste that time which is at least remaining, because it is nothing as all or none. Like it is nothing like you are going to study. I see many students who say that I will start fresh.
Yes.
But it is never fresh, because
not possible.
You will have some amount of residual knowledge which you should carry.
Yes.
Even if you are studying, even if you are fresher, if you study for these 4 months, the next preparation you will definitely have a benefit. Or what if it is possible that with your 4-month preparation you can get a good rank. Yes. So never rule out a probability that you might not get a good seat or not rank in this. The only key is consistency. You should rule out all your emotional and mental or psychological points which are coming into your mind, and keep studying whatever it comes in your way.
So any story or any chunk of experience you remember from your college days, or your professor has told you that this experience, that experience made your life better? One
experience I remember is one day what I did is there was a 8 a.m. lecture in the morning, and I knew that most of the students might not go.
Yeah.
And I knew the professor, I knew the topic, and then what I did was I in an anticipatory way, I read the topic in some amount. Like it was on lung cancer, it was surgery lecture, and I read it very, very like briefly. I didn't read it, and I knew the professor. The professor was a very senior professor, and like he was a type of person that he used to expect a lot from you.
Yes.
So I thought that I'll go in the morning lecture, but at least two or three people might come. So and when I went there, I was the first to sit in the lecture hall, and then I saw that sir came 5 minutes early, and sir sat down, and now I was worried that I feel that at least 1 or 2 students should come in, because I don't want to engage with him or interact with him or listen his lecture singly. Yes. So what happened, he waited for 5 minutes, and then I called my friends, most of my friends, and then when I called him and I said that okay, please come in, most of them then said that they're not coming. So then I was alone with my senior professor, and then after a few minutes of talking, he started the topic, and then it was so interactive. Like most lectures, they are like the professor teaches you, he's giving you information most of the time. But now what he planned was okay, you are the single person, now we'll interact. So he gave me a case scenario.
Yes.
So he's like, okay, now you have a 55-year-old female. Yesterday only I saw her. He's like, yesterday only I saw her, that patient. She had a grade 4 clubbing,
Yes.
had now osteoarthropathy and all, and cough since 6 months and all, so and so. And he started, and I was like, now I am just blank
Blank.
because
Yeah.
I didn't expect him to do so. So, and then later I realized that he didn't expect a lot from me, but then I gave him few answers, and he connected all the dots. He explained me, and then later he appreciated me that yeah, I gave some amount, or I stepped into his discussion, and then later I realized that it was a very good discussion because he used to take some points and he used to explain all the details.
Yes. How was your experience being on my podcast with Earthly? What's your feedback?
First of all, thank you for inviting me.
Yeah.
And you did a very great job. I feel that we need students like you to pass on all those precious information and all those things which are needed, because I feel that most of 80% of the students are very misdirected.
Yes.
They study a lot, and then they later they realize that so and so preparation is there. So I feel that, and I had a very great time interacting as well.
Yes.
So it was good, friendly interaction, and then it was very good questionnaire as well.
Yes.
So I felt that it covered almost all the things. Yeah. So please like, share, and subscribe to Chinmanan's channel for all the motivation and for all the experiences from the great seniors who have cracked all the different exams. Thank you.
Thank you, sir.